All right, I have another video. This goes into Bio-Statistician. Was it Knut M. Wittkowski? So let's get into this. This one's a little bit older, but it's linked to a one I just did about YouTube censoring him. So let's get into this. Stand up for your rights. It says Bio-Statistician, statistician Knut M. Wittkowski. Who is it Knut M. Wittkowski? He is among the many, even many hundreds of epidemiologists and other medical research professionals whose expertise was not consulted in the frenzied weeks in which the American political class at all levels chose panic and shutdown over rationality and rights. Considers bio. He received his PhD in computer science from the University of Stuttgart, his SCD in medical biometry. He worked for 15 years with Klaus Diess, a leading epidemiologist who coined the term reproduction number on the epidemiology of HIV before heading for 20 years to the Department of Biostatistics, Epidemiology, and Research Design at the Rockefeller University, New York. Dr. Wittkowski is currently the CEO of Asteria LLC, a company discovering novel treatments for complex diseases from data and genome-wide association studies. His work has been widely cited in the technical medical literature, so try to understand his frustration with everything going on around him. A lifetime of work towards understanding diseases and their spread, and he has to watch all this unfold in the most brutal way that contradicts everything he knows and has tried to reach. At the last moments of this interview below, he says the following: with all respiratory diseases, the only thing that stops the disease is herd immunity. About 80% of people need to have had contact with the virus, and the majority of them won't even have recognized that they were infected or that they had very, very mild symptoms, especially if they are children. So it's very important to keep the schools open and kids mingling to spread the virus, to get herd immunity as fast as possible. And then the elderly people who should be separated and the nursing homes should be closed during this time can come back and meet their children and grandchildren after about 4 weeks when the virus has been exterminated. We are experiencing all sorts of counterproductive consequences of not well thought through policy. Well, we will see maybe a total of fewer cases. That is possible. However, we will see more cases among the elderly because we have prevented the school children from creating herd immunity. And so in the end, we will see more death because the school children don't die. It's the elderly people who die. We will see more death because of the social distancing. If we had herd immunity now, there couldn't be a second wave in autumn. Herd immunity lasts for a couple of years typically, and that's why the last SARS epidemic we had in 2003, it lasted 15 years for enough people to become susceptible again, so that a new epidemic could spread of a related virus. Because typically there is something that requires cross immunity, so if you're exposed to one of the SARS viruses, you are less likely to fall ill with another SARS virus. So if we had herd immunity, we wouldn't have a second wave. However, if we are preventing herd immunity from developing, it is almost guaranteed that we will have a second wave as soon as either we stop the social distancing or the climate changes with winter coming or something like that. Extreme reactions cost U.S. taxpayers $2 trillion in addition to everything else that it costs, but it also has severe consequences for our social life, and depression is definitely something that we will be researching. I can say for myself, walking through New York City right now is depressing. We should be resisting, and we should at least hold our politicians responsible. We should have a discussion with our politicians. One thing we definitely need to do, and that would be safe and effective, is opening schools. Let the children spread the virus among themselves, which is necessary to get, which is a necessity to get herd immunity. That is probably one of the most destructive actions the government has done. We should focus on the elderly and separating them from the population where the virus is circulating. We should not prevent the virus from circulating among school children, which is the fastest way to create herd immunity. And the final question and answer. So is there anything else you'd want to say about this, that what's been aggravating you the most, or what would you like people to know? I think people in the United States and maybe other countries as well are more docile than they should be. People should talk with their politicians, question them, ask them to explain, because if people don't stand up to their rights will be forgotten. I'm Knut Wittkowski. I was at the Rockefeller University. I've been an epidemiologist for 35 years, and I've been modeling epidemics for 35 years. It's a pleasure to have the ability to help people understand. It's been a struggle. They're saying the video was taken down on YouTube, but they're pleased to copy it here. And it may be there, but because the web browser I'm using, it's not necessarily showing up. I'd ran for this previously before in another video, but there was the two doctors in California. They're like two ER doctors. They have their like own private firm, and like they're bringing people in. They're using their own statistics and stuff. And YouTube took their video down that they were talking about their own statistics that they were using for California as a whole. They're also mentioning, if they're like telling people to like shelter in place this whole time, if you stay inside for weeks or months on end, your immune system is going to get lowered. Like the lack of vitamin D that you're getting from sunlight and not going out, then staying in and like kind of hunkering by yourself, then all of a sudden when you go out, your immune system being weakened, you're like going to get sick. You may get more sick easily or more easily than you would normally. Also, what was I going to say? You get more sick easily. And also, what was I about to say? Well, because the issue here is like they took his video down. They also took the doctor's videos down as well, because they were like going against like the narrative that they were wanting to push, that they are working with like the World Health Organization, which has gotten things wrong, whether it's incompetence or ill will. That's still like, whether they're working with China or not, that's still to be seen. That's part of the reason that Trump had defunded the WHO, at least partially, until they like get their stuff together. But I can't remember what I was going to say with the two doctors. But essentially they were saying like, if you're like hunkering down, your immune system's going to get lowered. So they was just going into this to figure out more about Knut M Wittkowski. So he's obviously, he said he's been an epidemiologist for like 35 years. So he is an authoritative source on it, but they didn't like what he was saying, so they took his stuff down. So, all right, if you like this, you can give me a like. If you like it, you can subscribe. You can like and follow on Facebook. I have a subscribe star here if you wish to donate, follow, whatever all that good stuff is. I'm also trying to looking into possibly starting to put stuff on BitChute as well, because YouTube is kind of getting more terrible about censorship. So I figured BitChute would be a kind of like a backup and another avenue as well. But yeah, all right, peace.